Certified Surgical Technologist CST, practice test surgical instrumentation, equipment, and surgical procedures.
Question 1. Which of the following is a heavy, self-retaining abdominal retractor commonly used during open laparotomy procedures? Option A. Balfour retractor. Option B. White-Lehner retractor. Option C. Sen retractor. Option D. Army-Navy retractor.
The correct answer is option A, Balfour retractor. The Balfour is a large, self-retaining retractor used to hold open the abdominal wall during deep laparotomy cases. The White-Lehner is self-retaining but smaller, and Sen/Army-Navy are handheld.
Question 2. When using a monopolar electrosurgical unit, ESU, where is the safest and most appropriate placement for the patient return electrode, grounding pad? Option A. Over a bony prominence. Option B. Over a large, well-perfused muscle mass close to the operative site. Option C. Directly over a metal orthopedic implant. Option D. On the patient's forehead.
The correct answer is option B, over a large, well-perfused muscle mass close to the operative site. The grounding pad should be placed on a large, fleshy muscle mass, like the thigh or buttocks, that is clean, dry, hairless, and close to the surgical site to safely return the electrical current to the machine.
Question 3. During a surgical procedure on the upper extremity, arm, what is the maximum recommended inflation time for a pneumatic tourniquet before it must be temporarily deflated to allow tissue perfusion? Option A. 30 minutes. Option B. 60 minutes. Option C. 90 minutes. Option D. 120 minutes.
The correct answer is option B, 60 minutes. For the upper extremity, the maximum continuous tourniquet time is generally 60 minutes. For the lower extremity, it is up to 120 minutes. Exceeding these limits can cause severe tissue necrosis and nerve damage.
Question 4. Which of the following instruments is an atraumatic grasping clamp specifically designed to hold delicate tubular structures such as the bowel or fallopian tubes without crushing them? Option A. Coker clamp. Option B. Babcock forceps. Option C. Kelly clamp. Option D. Oxner clamp.
The correct answer is option B, Babcock forceps. The Babcock has flared, rounded jaws with no sharp teeth, making it an atraumatic grasper perfect for delicate tissues like the appendix, bowel, or fallopian tubes.
Question 5. During a laminectomy, which specific instrument is used to bite off and remove small pieces of the lamina and spinal bone? Option A. Cobb elevator. Option B. Penfield dissector. Option C. Carrison rongeur. Option D. Freer elevator.
The correct answer is option C, Carrison rongeur. The Carrison rongeur is a specialized, biting bone instrument used extensively in neurosurgery and orthopedic spine surgery to remove bone and enlarge the spinal canal.
Question 6. During a laparoscopic cholecystectomy, which specific gas is insufflated into the peritoneal cavity to create a pneumoperitoneum? Option A. Oxygen. Option B. Nitrous oxide. Option C. Nitrogen. Option D. Carbon dioxide, CO2.
The correct answer is option D, carbon dioxide, CO2. Carbon dioxide is used because it is non-toxic, highly soluble in blood, readily absorbed and eliminated by the lungs, and non-flammable, safe to use with electrocautery.
Question 7. During a dilation and curettage, D&C, which instrument is primarily used to grasp and provide traction on the anterior lip of the cervix? Option A. Heaney needle holder. Option B. Single-tooth tenaculum. Option C. Avard speculum. Option D. Sims uterine sound.
The correct answer is option B, single-tooth tenaculum. A single-tooth tenaculum has sharp, penetrating points designed specifically to securely grasp the tough, fibrous tissue of the cervix to provide traction during gynecological procedures.
Question 8. Which of the following patients requires special precautions and continuous monitoring by anesthesia when a monopolar electrosurgical unit, ESU, is in use? Option A. A patient with a titanium hip implant. Option B. A patient with a pacemaker or internal defibrillator. Option C. A patient with a history of asthma. Option D. A patient with an allergy to latex.
The correct answer is option B, a patient with a pacemaker or internal defibrillator. Monopolar ESU current can interfere with the function of an implanted pacemaker or ICD, potentially causing dangerous arrhythmias. Bipolar cautery is strongly preferred in these patients.
Question 9. Which of the following safety precautions are strictly required when a surgical laser is in use? Option A. All personnel and the patient must wear specific protective eyewear. Option B. Sterile water or saline must be available on the sterile field. Option C. Wet towels or sponges should be placed around the targeted surgical site. Option D. Only flammable alcohol prep solutions should be used. Option A, B, C.
The correct answers are options A and E and E and A and E and E and E and F and E and A and D and E and E and A and A and D and E and C and F and C and E and E and E and A and E and E and D and F and D and B and E and A and A and A and B and E and D and E and F and E and A and D and E and E and E and C and D and E and F and A and B and E and E and E and E and B and E and E and E and E and A and E and F and E. All personnel and the patient must wear specific protective eyewear. A, B, C. A, B, C. All personnel and the patient must wear specific protective eyewear. A, B, C. A, B, C. A, B, C. A, B, C. All personnel and the patient must wear specific protective eyewear. Only flammable alcohol prep solutions should be used. A, B, C. A, B, C. All personnel and the patient must wear specific protective eyewear. All personnel and the patient must wear specific protective eyewear. Only flammable alcohol prep solutions should be used. A, B, C. Wet towels or sponges should be placed around the targeted surgical site. Wet towels or sponges should be placed around the targeted surgical site. A, B, C. A, B, C. A, B, C. All personnel and the patient must wear specific protective eyewear. A, B, C. A, B, C. Only flammable alcohol prep solutions should be used. Only flammable alcohol prep solutions should be used. Sterile water or saline must be available on the sterile field. A, B, C. All personnel and the patient must wear specific protective eyewear. All personnel and the patient must wear specific protective eyewear. All personnel and the patient must wear specific protective eyewear. Sterile water or saline must be available on the sterile field. A, B, C. Only flammable alcohol prep solutions should be used. A, B, C. A, B, C. All personnel and the patient must wear specific protective eyewear. Only flammable alcohol prep solutions should be used. A, B, C. A, B, C. A, B, C. Wet towels or sponges should be placed around the targeted surgical site. Only flammable alcohol prep solutions should be used. A, B, C. All personnel and the patient must wear specific protective eyewear. All personnel and the patient must wear specific protective eyewear. Sterile water or saline must be available on the sterile field. A, B, C. A, B, C. A, B, C. A, B, C. Sterile water or saline must be available on the sterile field. A, B, C. A, B, C. A, B, C. A, B, C. All personnel and the patient must wear specific protective eyewear. A, B, C. A, B, C.
Question 10. Which surgical procedure involves the removal of the gallbladder, typically to treat symptomatic gallstones? Option A, cholecystectomy. Option B, appendectomy. Option C, colectomy. Option D, splenectomy.
The correct answer is option A, cholecystectomy. A cholecystectomy is the surgical removal of the gallbladder, cholecyst. It is most commonly performed laparoscopically.
Question 11. Which tissue forceps have small, interlocking teeth at the tip and are commonly used by the surgeon to approximate skin edges during wound closure? Option A, DeBakey forceps. Option B, Adson with teeth forceps. Option C, Russian forceps. Option D, Cushing forceps.
The correct answer is option B, Adson with teeth forceps. Adson forceps with teeth have fine, interlocking teeth that securely grasp the dense dermis without crushing it, making them the standard choice for skin closure.
Question 12. Which of the following instruments belong to the cutting and dissecting classification? Option A, Metzenbaum scissors. Option B, Mayo scissors. Option C, number 11 scalpel blade. Option D, Kelly clamp. Option E, Alice forceps.
The correct answers are options A and B and C. Metzenbaum scissors, Mayo scissors, number 11 scalpel blade. Scissors, Metzenbaum for delicate tissue, Mayo for heavy tissue, and scalpels are classified as cutting/dissecting instruments. The Kelly and Alice are clamping/grasping instruments.
Question 13. What does the surgical term anastomosis refer to? Option A, the surgical removal of an infected organ. Option B, the surgical creation of an opening to the outside of the body. Option C, the surgical joining of two hollow, tubular structures, like blood vessels or bowel, to restore continuity. Option D, the crushing of a kidney stone.
The correct answer is option C, the surgical joining of two hollow, tubular structures, like blood vessels or bowel, to restore continuity. Anastomosis is the suturing or stapling together of two tubular structures. For example, after a diseased segment of bowel is removed, the two healthy ends are anestomosed together.
Question 14. In which of the following procedures is a purse string suture technique commonly used? Option A. Appendectomy. Option B. Total knee arthroplasty. Option C. Cataract extraction. Option D. Craniotomy.
The correct answer is option A. Appendectomy. During an open appendectomy, a purse string suture is placed in the cecal wall around the base of the appendix to invert and bury the appendiceal stump after the appendix is removed.
Question 15. Phacoemulsification is an ultrasonic surgical technique used to break up and aspirate what structure in the eye, replacing it with an intraocular lens, IOL. Option A. The cornea. Option B. The retina. Option C. An opaque lens, cataract. Option D. The optic nerve.
The correct answer is option C. An opaque lens, cataract. Phacoemulsification uses ultrasonic energy to fragment a cloudy, cataractous lens so it can be suctioned out of the eye and replaced with a clear artificial lens.
Question 16. Which of the following instruments is a vascular clamp designed to partially or totally occlude blood vessels without causing permanent crush injury to the vessel wall? Option A. Satinsky clamp. Option B. Coker clamp. Option C. Towel clip. Option D. Peon clamp.
The correct answer is option A. Satinsky clamp. The Satinsky, along with Cooley and Bulldog clamps, features atraumatic, fine serrations designed to temporarily stop blood flow in delicate blood vessels without damaging the intima, inner lining.
Question 17. A myringotomy is a surgical procedure performed to treat chronic otitis media, middle ear infections. What is actually done during this procedure? Option A. The tonsils are removed. Option B. An incision is made in the tympanic membrane to drain fluid and place a ventilation tube. Option C. The nasal septum is straightened. Option D. The vocal cords are biopsied.
The correct answer is option B. An incision is made in the tympanic membrane to drain fluid and place a ventilation tube. A myringotomy, tympanotomy, involves making a tiny incision in the eardrum, tympanic membrane, to relieve pressure, drain fluid, and usually insert a PE, pressure equalizer, tube.
Question 18. During orthopedic or neurosurgical procedures involving cut bone edges, the surgeon may request bone wax. What is the mechanism of action of bone wax? Option A. It chemically reacts with platelets to form a clot. Option B. It causes severe vasoconstriction of the bone marrow. Option C. It creates a mechanical tamponade, physical barrier, to stop oozing blood. Option D. It regrows bone tissue.
The correct answer is option C. It creates a mechanical tamponade, physical barrier, to stop oozing blood. Bone wax is a sterile mixture of beeswax and isopropyl palmitate. It does not act chemically, rather, it provides a physical plug, tamponade, that blocks the bleeding channels in cut bone.
Question 19. A chest tube is placed into the pleural space to evacuate air, blood, or fluid. What medical condition is characterized by air accumulating in the pleural space, causing lung collapse? Option A. Hemothorax. Option B. Pneumothorax. Option C. Empyema. Option D. Atelectasis.
The correct answer is option B. Pneumothorax. Pneumothorax is the presence of air or gas in the pleural cavity, which disrupts negative pressure and causes the lung to collapse. A chest tube attached to a water seal drainage system restores this pressure.
Question 20. Which of the following is a specialized self-retaining retractor system commonly used during a craniotomy to carefully retract brain tissue? Option A. Greenberg retractor. Option B. O'Sullivan-O'Connor retractor. Option C. Finocchietto retractor. Option D. Gelpi retractor.
The correct answer is option A. Greenberg retractor. The Greenberg, or Leyla-Yassargil, system mounts to the skull clamp and utilizes flexible, snake-like arms with brain spatulas to gently retract delicate brain tissue.
Question 21. What is the name of the low transverse abdominal incision most commonly used for performing a cesarean section? Option A. McBurney incision. Option B. Midline laparotomy incision. Option C. Pfannenstiel incision. Option D. Subcostal incision.
The correct answer is option C. Pfannenstiel incision. The Pfannenstiel incision is a curved, transverse incision made just above the pubic symphysis. It provides excellent pelvic exposure and heals with a stronger, more cosmetically appealing scar.
Question 22. Why is a satin or matte finish preferred over a highly polished, mirror, finish on surgical instruments? Option A. It makes the instruments lighter. Option B. It prevents the instruments from rusting. Option C. It reduces glare from the bright overhead operating room lights. Option D. It is cheaper to manufacture.
The correct answer is option C. It reduces glare from the bright overhead operating room lights. A satin or matte finish absorbs light rather than reflecting it. This reduces eye strain and dangerous glare for the surgeon working under high intensity or lights.
Question 23. What does the orthopedic acronym ORIF stand for? Option A, open reduction internal fixation. Option B, orthopedic realignment internal fracture. Option C, open resection internal fascia. Option D, osteotomy reduction implant fixation.
The correct answer is option A, open reduction internal fixation. ORIF stands for open reduction internal fixation. It means the surgeon makes an incision, open, physically realigns the broken bone, reduction, and secures it with hardware like plates and screws, internal fixation.
Question 24. How many Raytech, radiopaque, sponges come securely bundled in a standard, commercially prepared sterile package? Option A, 5. Option B, 10. Option C, 15. Option D, 20.
The correct answer is option B, 10. Raytech sponges, commonly 4x4s with a radiopaque thread, always come in packages of 10. Laparotomy sponges, lap pads, come in packages of 5. This standardization is critical for accurate sponge counts.
Question 25. Which of the following are physical components of a rigid endoscope? Example, a laparoscope or cystoscope. Option A, objective lens. Option B, light post. Option C, eyepiece/ocular. Option D, cautery grounding wire. Option E, trocar sleeve.
The correct answers are options A and B and C. Objective lens, light post, eyepiece/ocular. A rigid endoscope consists of an eyepiece, where the camera attaches, a light post, where the fiber optic light cord attaches, and a long shaft containing relay lenses ending in an objective lens.